Maintaining a strong pelvic floor is crucial for women of all ages. Just like any other muscle group, these muscles can benefit from regular exercise. Kegel exercises offer a simple and effective way to strengthen these vital muscles. By incorporating Kegels into your daily routine, you can experience a range of positive effects on your overall well-being. Kegel exercises are gentle contractions and relaxations of the pelvic floor muscles. These muscles support the bladder, uterus, and rectum. Think of Kegels as a gentle squeeze and lift action, similar to holding back urine flow. These exercises are discreet and can be done anytime, anywhere. Regular Kegel exercises offer numerous benefits. They can help prevent urinary incontinence, a common issue especially after childbirth. Strong pelvic floor muscles can also enhance sexual pleasure and satisfaction. Moreover, Kegels can improve bladder control and reduce the risk of pelvic organ prolapse. Section 4. Locating your pelvic floor muscles. This is a crucial step in ensuring you perform Kegel exercises correctly and effectively. Before you begin Kegels, it's essential to identify the correct muscles. These muscles form the base of your core and support your bladder, uterus, and rectum. Imagine you are trying to stop the flow of urine midstream. This action helps you isolate the pelvic floor muscles. The muscles you engage are your pelvic floor muscles. They play a vital role in maintaining continence and sexual health. Another way to locate them is to insert a clean finger into your vagina and try to squeeze the muscles around it. This method provides a tactile way to ensure you're targeting the right muscles. These are the muscles you will be working during Kegel exercises. Regular practice can lead to improved bladder control, enhanced sexual pleasure, and overall pelvic health. Section 5. Mastering Kegel exercises, a step-by-step guide. In this section, we will walk you through the essential steps to effectively perform Kegel exercises, which are crucial for strengthening your pelvic floor muscles. First, find a comfortable position. This could be lying down on a mat, sitting on a couch with pillows for support, or even sitting comfortably on a chair. You can do Kegels lying down, sitting, or standing. Choose the position that feels most comfortable and allows you to focus on your pelvic floor muscles without any distractions. Ensure your abdominal and buttock muscles are relaxed. Take a few deep breaths to help release any tension in these areas. This will help you isolate the pelvic floor muscles more effectively. Next, contract your pelvic floor muscles. Imagine you are trying to stop the flow of urine or prevent yourself from passing gas. This is the sensation you should feel when you contract the correct muscles. Gently squeeze and lift these muscles, as if you are trying to stop urine flow. It's important to do this gently to avoid straining the muscles. Hold the contraction for a count of 3 to 5 seconds. Then, relax your muscles. Remember to breathe steadily and avoid holding your breath during the exercise. Slowly release the contraction and allow your pelvic floor muscles to relax completely. Take a deep breath and feel the relaxation in your pelvic area. Rest for a count of 3 to 5 seconds. This brief rest period is crucial to prevent muscle fatigue and ensure you can perform the next repetition effectively. Repeat this process. Aim for 10 to 15 repetitions, 3 times a day. Consistency is key to seeing improvements in your pelvic floor strength. As you progress, you can gradually increase the hold time and the number of repetitions. Over time, you will notice a significant improvement in your pelvic floor strength and overall control. Section 6. Patience and progress. When to expect results. Like any exercise program, consistency is key with Kegels. You may start noticing improvements in bladder control or reduced leakage within a few weeks of regular practice. However, it can take several weeks or months to achieve significant strengthening of your pelvic floor muscles. Be patient with yourself and stay committed to your routine. Section 7. Embrace the journey to a stronger you. Incorporating Kegel exercises into your daily life is a powerful step towards improving your pelvic health and overall well-being. These exercises are simple yet effective and can be done almost anywhere, whether you're at home, at work, or even while commuting. Remember to focus on proper form and consistency for optimal results. Consistency is key. Make it a part of your daily routine. If you experience any pain or discomfort during Kegels, consult with your doctor or a pelvic floor therapist for guidance. They can provide personalized advice and modifications to ensure you're doing the exercises correctly and safely. Embrace the journey to a stronger, healthier you. Celebrate each small victory along the way, and remember that every step you take brings you closer to your goal of improved pelvic health and overall well-being.